One foot goes in front of the other, just like you do a barbell curl, because you need more stability in this direction, not side to side. So you push down the bar all the way first, and then the next thing you do is this deal, the retraction. Because when she pulls her shoulder blades back, it makes it so that the shoulder is more congruent. The bones sit better. So these are back, and then now do your thing, Tawny. So she's going to come up to about here, and then she's going to push back down again. But she's not pushing towards her body. She's actually pushing out and away from herself. Go and get in your rhythm here. And then down, and then right back up again. So she's not stopping, and she's giving me that. Yeah, that is hard to do. Now notice that, let's say that this is Tawny's right arm, right? Here are the triceps here, and they connect to the shoulder blade. These, they come up and they insert right up underneath here. So they're constantly pulling the shoulder blade forward, which can actually be hazardous on the shoulder. That is why, see, she fights this every step of the way. The shoulder blade pops forward like it is now, and she's going to fight that the whole time without arching her back and keeping her belly in. Lots of pieces to the puzzle. So the triceps are here, right? Now, don't, especially ladies, don't confuse this with thinking that, oh, I have a lot of flab on the back of my arm, so I need to do the triceps push down for that flab. You have good muscles now. The muscles are there. But whether or not you can see them is a different story. So it's a combination of resistance training, cardiovascular exercise, sleeping right, and eating right. It's not one thing.
Today on The Fitness Show, I have a special guest here on Doc Talk. It's Dr. David Conant-Norville. He's a psychiatrist. Dr. Norville.
Hi, Colin.
Good to see you. Great
Thanks.
to see you. Can you tell everybody a little bit about yourself, what you do, what you tend to see in your office?
Sure. Colin, I'm a child and adolescent psychiatrist. I see about 2/3 children and adolescents, about 1/3 adults. We see children with all sorts of problems, and their parents actually, because many of these disorders tend to be genetic disorders. See a lot of folks with depression, with attention deficit hyperactivity disorder, anxiety disorders, and then some of the more serious psychotic disorders.
And so, since this is the fitness show, I'm going to kind of spin it now towards what I'm trying to figure out now relative to fitness. To what extent does exercise and fitness lifestyle, how much of a role does that play now in treating and maybe even preventing certain disorders related to depression?
Well, that's a great question. Actually, what we hear most in the media oftentimes is that medication is what you do to treat depression or psychotherapy. But in reality, what I look at is total lifestyle. I look at the sleep process, I look at exercise, I look at relationships, and I look at diet. Medication is an important tool, but really what we've found is that exercise is as effective, especially for something like anxiety disorders or mild to moderate depression. Exercise is as effective as antidepressant medication with fewer side effects.
So a drug company watching this may not like to hear this as much, that if somebody can actually start treating themselves just by simply changing their lifestyle, which is obviously a much more cost-effective mode of treatment, which makes more sense.
Well, I don't know if the drug companies like it or don't like it. I assume that they would like it if people didn't have depression, actually.
You would hope.
and I would. And quite frankly, I think that I use medication very effectively with exercise and with diet and with building relationships. As you might know, depression is a mood disorder. It's a disorder of how you feel. And it's a disorder that you really can't get to in the brain by just telling someone feel differently. So what we have to do is you have to behave differently, you have to think differently, and the biological approach is use of medication.
And so let's say that somebody watching this, or they may even know this, if they suspect that they are in fact clinically depressed, what's their next step? When should they actually seek professional help?
Well, major depression is a medical illness, and anytime there's a medical illness, it's good to seek medical consultation as soon as possible. One of the basic tenets of medicine is identify problems early and treat it effectively early, as opposed to waiting until it gets worse and worse and worse. The problem with depression is that people, it's not just that people are sad, it's that people just lose enjoyment. They stop caring. They stop, their interest level is low, they don't sleep very well, they're sort of irritable, and so it's hard for them to start a new program. It's not, so if you're depressed, you're not all of a sudden going to rush out and say, now I need to exercise. And so oftentimes you see a problem, or someone else may see a problem in you and encourage you to seek medical care. One of the nice things about medication is it's easy. You take a pill and it actually works pretty well. The bad thing about medicine is if you don't take the pill, it doesn't work, and it isn't an ongoing activity, and it doesn't have all the spin-off health benefits that an exercise program would have.
And so what are the most common obstacles you tend to see relative to patient care, relative to getting people to buy in to the whole exercise regimen idea?
Well, you think of it as a long-term approach, not a short-term approach. Short-term is you get done with the depression. The bad news is if you have depression, more likely than not, you're going to have another depression. And so you have to develop coping skills so that if you feel a depression coming on, then you head it off. And you head it off by how you think, how you set goals, how you behave, who you relate to, and exercise. How you manage your sleep pattern is a good thing. Now, one of the problems I've seen with folks that I tell, now we got to get exercise, is they don't know how to exercise. Mm-hmm. That's a big problem.
Hence the fitness show.
Hence the fitness show. But the point is, if you know how to exercise and it's already part of your life, it's easy to get into the habit of exercising. Okay, I need to exercise. I'm very determined. I really have to exercise. And I have many patients that treat their depression with exercise solely. And it's because they know how to exercise. Now, many people not only don't know how to exercise, they may have problems with their hips, their joints, like knees, ankles, their back. And so for those folks, they need a specialized exercise program. And by the way, I might tell you that the British government has looked into this, and in the last 5 years, they've put in a whole program to get general practitioners to refer folks for exercise. Now, the research shows that exercise is only effective if it's a structured exercise program and it's a supervised exercise program. So oftentimes what I do with folks that don't know how to exercise or don't have a plan is I refer them to somebody that can give them directions and teach them how to exercise. Now sometimes this may be a personal trainer. For folks that have orthopedic problems, you really want to make sure that they have those orthopedic problems evaluated maybe by another physician, the primary care physician, by a physical therapist, and get them on the road to a gradual, safe exercise program that you know that they can sustain.